Friends, Michael, licensed physio with Total Physical Therapy. Today I'm going to share with you a recent series of events that happened in the clinic because my guess is that one or more of you viewers are actually dealing with the same symptoms and you may even have the same reservations. This individual phoned our clinic and had some reservations about physical therapy, and they were highly warranted. It's just that they weren't forthcoming with those reservations in the beginning. So let's paint the picture here. The individual called our clinic and was describing what I presume to be positional vertigo, which is actually one of the most commonly occurring forms of vertigo. And luckily for us, it's oftentimes very quickly treatable. The individual described these symptoms and they suggested that they had seen their primary care physician who had done two things. They had prescribed meclizine and they had recommended physical therapy. Now, the individual, in their reluctant voice, was suggesting that they felt like the meclizine was actually improving their symptoms, and because they felt that the improvement was occurring, they wanted to hold off on therapy. Now, it's important to note that meclizine is a symptom suppressor. It's not designed to fix vertigo, rather it's just simply designed to suppress some of the most uneasy symptoms that come about because of positional vertigo. I educated the individual on that fact and the other fact that it was more likely that she would actually get a quote-unquote fix of her symptoms because of normal daily routine movements of the body and head. That's more likely to create a change to the symptoms than just suppressing it with the medication. Also inform them that those random daily movements could be structured and specific with oftentimes just one simple treatment session with physical therapy, but they were still reluctant, and I empathized with that. Vertigo is not an easy thing to deal with, and you darn sure don't oftentimes want to go to therapy when they tell you, hey, we've got to provoke the symptoms to actually find the treatment technique. I can empathize with not wanting to go through those symptoms again. It's miserable. But I encourage this individual to go over the weekend and go into the next week and call us if the meclizine was not getting rid of the symptoms. I had high anticipations that we would hear from the individual again, and we did. We had a second phone call with this individual. At that point in time, they came to the confirmation that the meclizine really wasn't getting rid of their symptoms and that they would like to consider physical therapy at this point, but there was a big but. They were concerned that some of the treatment techniques might impact their previous surgical implant of hardware in the neck. They had undergone a cervical fusion, and for those of you unfamiliar with what a cervical fusion is, let's just say it's a surgical procedure that puts pins and plates inside of the neck to adhere two or more bones to help reduce excessive motion. It's important to also note that over longer stretches of time, that hardware actually has less and less meaning. What do I mean by that? Well, that hardware is there temporarily to actually allow two bones or two or more bones to actually adhere to one another. They will actually fuse themselves, and that's why we call it a cervical fusion. It's not that that hardware is holding those bones together for long stretches of time. If you have a normal bony tissue response to them actually being stuck together and mended together with grafts of bone. Okay, with that truth out of the way, then let's bring in another fact about this case, and this was the fact that the individual had had this fusion almost a decade prior. Many years prior, plenty of time for bones to actually fuse and adhere together. So at this point, the hardware's in there, but it's really non-functional. It's not doing anything, and any and all motion that's available in the neck at that point, at the level of the fusion, is not going to be supported by the hardware. So it's too risky to go in and take this stuff out, and so only in rare cases will this actually be done. So it's just kind of stuck with you for the remainder of your life years. So this individual, however, was worried about that, and with some very simple education, we helped to not only confirm what I just suggested, that there was essentially no risk to any type of hardware damage, but the other truth was, the other fact was, is that we don't need a lot of neck motion to actually treat the symptoms, and we never do it with any type of manipulation. It's oftentimes a misunderstanding that we have to whip and twist and contort your neck into funny places to actually treat the vertigo. Oftentimes there's minimal movement of the head and neck to actually treat the symptoms, and the big thing is we try to change you from one position to the next in a strategic but very quick method. It's the quick movement that is key and pertinent to the treatment techniques. But with that being said, before we even go into those treatment techniques, we're always assessing to see, do we have enough neck motion to put you into the right position? So let's take a worst case scenario. Let's say an individual either has some type of precautions with maybe a recent surgical procedure where it's not stable enough yet, or maybe even another case where they have such extreme severe arthritis of the neck that they just don't have enough neck motion. They're essentially just stuck in one position. Well, if this worst case scenario happens, we don't have to twist and contort the neck into funny positions. We can simply change the position of the body. We have techniques and equipment where we will actually put the entire body into the most appropriate treatment position. We don't have to put the neck per se into that position. So after we educated this individual on all of these truths about how we were going to go about treating it, the reservations quickly were dissolved. They came into the facility. Lo and behold, we went through one very simple treatment technique after we identified the problem, and 5 minutes later they were sitting there saying, I don't feel any symptoms. So with a quick retest, the first position that actually induced the symptoms, we put them into the retest position, and voila, symptoms are gone. Follow up by a couple days, symptoms still gone, and this person is happy-go-lucky. They are thrilled. But however, they had these reservations in the very beginning that if they were just forthcoming and they said, listen, this is what I have reservations about. I've got this neck fusion. Will the treatment techniques in any way mess up my neck or put me in pain that I don't want to endure? And we could have gone through all this education on the very first phone call. So if that's you, if you have reservations about treating positional vertigo with your local physios because you're worried about how your neck can or can't move, or you maybe even have a case where you have that hardware and you're worried about it, fear not. We have techniques and remedies around these types of situations. If you found the information useful, share it with others, because I know you're not the only one that has these concerns. If you haven't already subscribed to the channel, we encourage you to do so as well. Smash that like button. Come back and see us again. As always, have a beautiful day. We'll talk to you soon.